Good morning, everyone. So as Dr. Qasim said, I'm a clinical dietitian and a public health specialist. Just a quick background on myself, about my education. Basically, I have a 5-year background experience in medical education. Yeah. Basically, I had a 5-year experience in the medical field at Royal College of Surgeons in Bahrain, and then I went on to change my profession to nutrition and public health. So I got my master's in pediatric nutrition. In terms of work experiences, I have a 5-year work experience in the UK and in Europe as a freelance nutritionist. Then I went on to be a bariatric a nutritionist at Salam Specialist Hospital. At the moment, I'm at DR Medical Center as a holistic nutritionist. So in terms of scopes of services, we deal with overweight and obesity, so childhood and adult obesity, malnutrition, pediatric nutrition. So it goes all the scopes in terms of picky eating, food allergy alternatives, and any sort of eating disorders that might occur during the teenage years, cognitive behavioral therapy, pre and postnatal nutrition, pre and post bariatric surgery and procedures. So that includes gastric sleeve surgery, gastric balloon, chronic illnesses such as diabetes, cholesterol, hypertension, PCOS, metabolic syndrome, cancer, epilepsy, GI disorders, tailored meal plans, and sports nutrition. So today we're going to be talking about childhood obesity very briefly, because around 55% of obese children do go on to become obese adolescents, and then 80% of those obese adolescents go into becoming obese adults, which is the main cause of metabolic syndrome, which is a huge predominant issue here. So 1 in 3 adults suffer from metabolic syndrome. So causes of childhood obesity, 30%, 40% goes to genetics, and then the other 60 to 70% are due to environmental factors, which include poor diet, sedentary lifestyle, psychological factors, socioeconomic factors, and certain medications. So just a few tips on prevention of childhood obesity. So the first step is educating the parents on the importance of keeping a healthy weight before conception. That goes for the males and females. Second is encouraging breastfeeding. Third is always introduce veggies before fruits at the weaning stage as the child's first food. Making sure to include at least 5 portions of veggies and fruits per day, 3 of which should be vegetables. Limiting screen time to 1 hour per day, encouraging eating meals slowly and without any distractions. So no iPads, no TV, no any sort of distraction. Keeping healthy meals and snacks always available and in their eyesight if possible. It can be as simple as a bowl of fruit. And then educating parents on proper cooking techniques to maximize nutrition absorption from foods, increasing satiety while avoiding unnecessary extra calories, and then teaching intuitive eating as early as the toddler stage. So we don't force our kids to have any meal more than their satiety levels, just so that we don't go across the hunger and fullness stage. And then encouraging family mealtime and family active activity. So it can be in any outdoor sports or indoor sports, just to include the whole family in keeping a healthy lifestyle. So in terms of healthy food and positive body relationship, so we never use food as a reward or withhold food as a form of punishment. We avoid commenting on outer appearance, whether it's positive and negative, and instead focus on the child's performance instead, whether it's educational or in terms of activities or sports. And then we never label foods as good or bad, because this causes further obsession with junk foods. And this is what we see with most patients, most bariatric patients, which they still suffer from after surgery. And then, so one of the main ways of addressing picky eating at a young stage is by repeated exposure, parent modeling. So no matter how much you explain to your kids and lecture them about healthy eating, it's not the same as modeling it yourself. And then positive food environment, and then always serve a safe food for your child when introducing a new food, such as a veggie or a fruit. And thank you very much.